Good morning, wherever you are. This is Tumor Crusher from ConferenceHype. Our segment will focus on systemic treatment followed by radical resection combined with intestinal autotransplantation for locally advanced pancreatic cancer, a retrospectively observational and prospectively validated study. From the 2026 August edition of Advances in Radiation Oncology. Background: xerostomia remains a common toxicity after head and neck radiation therapy that significantly impacts patients' quality of life. Methods: although intensity-modulated radiation therapy reduces the dose to the salivary glands, many patients still experience salivary gland toxicity. Results: analysis of 329 patients using a linear mixed effects model revealed distinct volume change patterns. Discussion: objective measurement of salivary gland volume can be used as an indicator of damage and recovery. From the 2026 August 7 edition of European Heart Journal. Background: conduction disturbances and permanent pacemaker implantation remain the most common complications after transcatheter aortic valve implantation. Methods: the strongest predictors of conduction abnormalities and subsequent permanent pacemaker implantation after transcatheter aortic valve implantation include pre-existing right bundle branch block, a short membranous interventricular septum, deep transcatheter heart valve implantation, and valve type. Results: importantly, both new permanent pacemaker implantation and new left bundle branch block after transcatheter aortic valve implantation are associated with increased mortality and heart failure hospitalizations. Discussion: this review aims to provide an overview of the incidence, pathophysiology, and consequences of conduction disturbances after transcatheter aortic valve implantation, discuss preventive strategies, highlight the relevant ongoing studies, and provide an evidence-based framework for the management of this important clinical issue. From the 2026 August edition of Advances in Radiation Oncology. Background: locally advanced soft tissue sarcomas cause significant tumor mass effects, often leading to onerous symptoms. Methods: our institution has previously developed partially ablative body radiation therapy for palliation in these circumstances, which has demonstrated effective symptom relief. Results: the median age was 73 years and 56 years in the PABR and SBR groups, respectively. Discussion: PABR for bulky unresectable sarcomas may provide improved palliation of symptoms compared to SBR, with potentially better local control despite treating significantly larger tumors. From the 2026 August 1 edition of Annals of Surgery. Background: severe acute pancreatitis affects 20% of patients with AP and is associated with high mortality rates. Methods: we analyzed data from a prospective database of patients with AP admitted to Vall d'Hebron Hospital from November 2015 to January 2022. Results: out of 634 cases, 594 were analyzed. Discussion: the ML models showed good predictive capacity for SAP, ICU admission, and mortality using early-stage data without laboratory or imaging tests. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, up to half of patients switch or discontinue antihypertensive medications within the first year, but underlying mechanisms remain elusive. Methods: using longitudinal medication data from 400 genotyped antihypertensive medication users across 3 cohorts. Short-term antihypertensive medication use trajectories were classified as continue, switch, or discontinue. Results: in total, 14 genome-wide significant loci were identified for switching from angiotensin-converting enzyme inhibitors and dihydropyridine calcium channel blockers to other antihypertensive medications. Discussion: these findings extend the bradykinin hypothesis of ACEI-induced cough by implicating neurotensin and TSR1 signaling. Pinpoint CYP3A4*22 as a novel functional predictor of DCCB switching with potential for genotype-guided prescribing. and validate medication use trajectories as a framework for pharmacogenetic discovery. From the 2026 August 1 edition of Annals of Surgery. Background: PanNets uncommonly present as cystic lesions. Methods: clinicopathologic data of patients with resected PanNets were collected from 4 high-volume centers between 2000 and 2019. Results: of the 1727 patients undergoing pancreatectomy for PanNet, the median age was 58.1 years, and 53.3% were males. Discussion: cystic PanNets have a more benign course than their solid counterparts, and conservative management can be considered for endoscopic ultrasound-guided fine needle aspiration. Proven cystic PanNets less or equal to 3 cm. From the 2026 August 4 edition of Circulation. Background: extracranial bleeding is the most common complication of oral anticoagulant therapy for atrial fibrillation, but its clinical importance for patients may be underrecognized. Methods: we analyzed patients receiving OACs from 5 pivotal randomized trials testing a direct OAC or warfarin in patients with AF, combine EF-A collaboration between multiple institutions to better investigate non-vitamin K antagonist oral anticoagulant use in atrial fibrillation. Results: of 73,737 patients treated with OACs, 10,634 experienced clinically relevant extracranial bleeding over a mean follow-up of 705 days. Discussion: extracranial clinically relevant bleeding is common among patients with AF treated with OACs and may more accurately reflect the overall burden of bleeding than major bleeding alone. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August edition of Advances in Radiation Oncology. Background: consensus guidelines from IBS-GEC ESTRO-ABS. Indian Brachytherapy Society Group, European Decuriotherapy, European Society for Radiotherapy and Oncology, American Brachytherapy Society, for computed tomography-based contouring, have recently introduced possibilities of CT-based adaptive brachytherapy for cervical cancer. Methods: the present study attempts to validate the guidelines by using magnetic resonance imaging at diagnosis and in a pre-BT environment. Results: 208 scans from 104 sets of 52 patients of CT and magnetic resonance scans were the basis for this study. Discussion: despite the dimensional differences, there was no dosimetric difference in HRCTV and IRCTV. From the 2026 August 5 edition of European Heart Journal. Background and AIMS, binary classification of adverse pregnancy outcomes may obscure differences in women's long-term cardiovascular disease mortality. Methods: a total of 1,409 women with complete pregnancy histories were identified from the Medical Birth Registry of Norway, and linked to the Norwegian Cause of Death Registry for premature CVD mortality. Results: for composite APOs, women with APOs in first pregnancy and no further pregnancies had the highest CVD mortality, followed by those with APOs in both first and later pregnancies. Discussion: considering APO sequence across complete pregnancy histories provides more detailed CVD information than binary classification. From the 2026 August edition of Advances in Radiation Oncology. Background: integration of radiation oncology content into the educational offerings of other cancer specialty societies may improve the use of radiation therapy in guidelines concordant care. Methods: however, minimal data describes the extent to which this occurs. Results: a total of 20% of education sessions included an RO speaker or moderator, comprising 6% of 1419 total speakers. Discussion: radiation oncologists are uncommon speakers at ASCO annual meeting sessions and have low and declining rates of involvement in planning committees. From the 2026 August 4 edition of Circulation. Background: myocardial ischemia-reperfusion injury compromises therapeutic effects of revascularization and leads to functional impairment and exacerbation of structural damage in the heart. Methods: we here systematically analyze the murine MIR model database to screen the potentially protective lysosome-localized proteins against MIR injury. Results: LAPTM4A stood out as a significant protective lysosome-localized protein from the screening. Discussion: our findings screened out and validated that LAPTM4A is a lysosome-localized protein exerting protective effects against MIR injury by facilitating autophagic flux. From the 2026 August 7 edition of European Heart Journal. Background: tricuspid regurgitation is a common yet historically neglected condition associated with poor outcomes. Methods: traditionally managed conservatively, TR has recently gained renewed attention, thanks to advances in surgical and transcatheter interventions. Results: tricuspid regurgitation is a common yet historically neglected condition associated with poor outcomes. Discussion: by harmonizing diagnostic standards and promoting a structured approach to patient assessment within HVCs, this review aims to facilitate timely referral and ensure consistent evaluation and management of patients with this complex and often underestimated condition. From the 2026 August edition of Advances in Radiation Oncology. Background: dysgeusia is a common toxicity experienced by patients with head and neck cancer receiving radiation therapy. Methods: in this study, we assess the timescale of onset, progression, and recovery of dysgeusia using an objective measure. Results: of the 50 patients who underwent baseline taste testing, 32 completed 12-week post-RT follow-up assessments. Discussion: this study confirms significant alterations in taste perception in patients with HNC during after RT. From the 2026 August edition of Advances in Radiation Oncology. Background: spatially fractionated radiation therapy is a promising treatment involving the delivery of discrete spheres of high-dose radiation, potentially enhancing treatment response. Methods: despite encouraging results for adult patients, no SFRT data exist in pediatric patients. Results: 5 pediatric patients who received SFRT were identified, with a median age of 15.7 years. Discussion: we present one of the first case series of SFRT in pediatric patients, with favorable local control and toxicity results. From the 2026 August 4 edition of Circulation. Background: the UK Biobank imaging study with its dedicated cardiovascular magnetic resonance substudy has redefined the scale and scope of cardiovascular research, generating high-quality imaging in 100 participants with linkage to rich genetic, demographic, lifestyle, and clinical data. Methods: the resource has enabled transformative discoveries across genomics, epidemiology, and biomedical engineering and has served as a global blueprint for population imaging studies. Results: its success has been accelerated by an equitable data access model that fosters international collaboration. Discussion: this article provides an overview of the UK Biobank and its cardiovascular magnetic resonance substudy, systematically reviews publications to date, discusses limitations and methodological considerations, and highlights future directions. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of Annals of Surgery. Background: PHPT was associated with increased cardiovascular morbidity and mortality. Methods: the electronic health database encompassing the entire public health system in Hong Kong from 2006 to 2023 was used to emulate a randomized controlled trial. Results: among 6898 PHPT patients identified, 1959 underwent parathyroidectomy. Discussion: parathyroidectomy reduced the risk of MACE in patients with PHPT. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, intake of ultra-processed food is positively associated with arterial hypertension. However, the association with specific markers of ultraprocessing has not been assessed so far. Methods: this exploratory prospective cohort study included 101,560 non-hypertensive UK Biobank participants who completed at least one 24H dietary recall. Results: over a median follow-up period of 10.5 years, 7633 hypertension cases appeared. Discussion: only some MUP categories, i.e. flavor, coloring agent, sweetener, and varieties of sugar, are positively linked to incident arterial hypertension. From the 2026 August 4 edition of Circulation. Background: atherosclerosis is the primary underlying cause of coronary artery disease. Methods: control mice and VSMC-restricted LMOD1 knockout mice were subjected to various atherogenic regimens. Results: a lethal neonatal visceral myopathy occurred in LMOD1 SMKO mice using Me11-CRE-ERT2, prohibiting further investigation. Discussion: under atherogenic conditions, LMOD1 SMKO mice present with rapid-onset coronary atherosclerosis. From the 2026 August 1 edition of Annals of Surgery. Background: the risk of developing CRC varies depends on the expression of mismatch repair proteins. Methods: in this retrospective study, we included a Danish cohort of patients who underwent surgery for CRC between 2009 and 2020. Results: a total of 3625 patients with localized deficient mismatch repair CRC were included in the study. Discussion: in patients with localized deficient mismatch repair CRC who underwent surgery, a significant association was found between loss of MSH2 MSH6 versus loss of MLH1 PMS2 expression and OS. From the 2026 August 3 edition of European Heart Journal. Background and AIMS, congenital heart defects aggregate in families, but recurrence patterns across kinships and generations remain incompletely understood. Methods: a retrospective population-based case control study was conducted, including 51,778 individuals with CHD born between 1987 and 2017, and 522,543 matched controls. Results: among individuals with at least one affected relative, the OR for CHD was 2.71, increasing with each additional affected relative. Discussion: congenital heart defect in a relative is associated with CHD in the index individual, with recurrence patterns varying by kinship and number of affected relatives. From the 2026 August 7 edition of European Heart Journal. Background: three-dimensional echocardiography has become an essential tool in the evaluation and management of valvular heart disease, offering superior accuracy and detailed visualization when used with the transthoracic and transesophageal approaches. Methods: the rise of transcatheter valve interventions, particularly for high-risk or inoperable patients, has underscored the importance of 3D imaging in guiding these procedures. Results: 3D echocardiography allows for precise assessment of valvular anatomy, quantification of regurgitation, and visualization of complex lesions, contributing to better procedural planning and outcomes. Discussion: this review highlights the growing role of 3D echocardiography in the management of VHD, emphasizing its evolving technology and applications in diagnostic precision and procedural guidance. From the 2026 July 28 edition of Circulation. Background: cardiovascular diseases, particularly stroke, are leading causes of dementia. Methods: several common cardiac interventions such as coronary artery bypass grafting and transcatheter aortic valve implantation are also associated with cognitive decline. Results: several common cardiac interventions such as coronary artery bypass grafting and transcatheter aortic valve implantation are also associated with cognitive decline. Discussion: we hope that the proposed composite outcome and multiple use cases presented spark progress in cardiovascular research toward more inclusive approaches to the study of cognitive outcomes that move beyond the confines of cognitive tests alone. From the 2026 August edition of Advances in Radiation Oncology. Background: retractions in the scientific literature undermine research integrity and can have lasting effects on clinical and academic practices. Methods: the aim of this systematic review was to analyze retracted publications in the recent radiation oncology literature and to identify trends in study characteristics, reasons for retraction, and post-retraction citation patterns. Results: a total of 108 retracted studies were identified and analyzed. Discussion: this study found that retractions in radiation oncology remain generally rather rare events. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. concludes the ConferenceHype weekend roundup of the top medical journal articles of the week. Which study could change practice and which paper should we revisit in greater depth? If we missed an important article, tag on X and join the discussion. Share this roundup with a colleague or your clinical team, add your perspective in the comments, like the video, and subscribe with notifications turned on for next week's journal coverage.